I'm Dr. Cintron, and this is Dr. Lee.
Yes.
And Dr. Lee, I want you to tell me about what you do.
I have been practicing acupuncture for over 30 years, and so acupuncture has been used for different pain and different gynecological problems for over 5,000 years. But when I get here, started practicing since 2000, I noticed that many people came to me for TMJ, and as a dentist, I think you have more knowledge about TMJ. What caused the TMJ?
Well, that's a very good question. Right now, compared to 30 years ago, like 100% of the people that come have problems with the TMJ versus say 35 years ago when I started as a dentist. What I noticed is that with the increase of anxiety and the electromagnetic frequencies, okay, the Wi-Fi, the sugars, the diet, the pesticides, all the things that are causing your body to not be as strong as it used to be when my mom was young in the 1950s and 1960s. People were happier, more relaxed. Now everybody is on a train going 80 miles an hour. So my patients don't even know, oh, I don't do that. I don't clench my teeth. I don't. And then I say, okay, I have 30 photos. Let's look at them together. So we look at the photos and they are like in shock when they see that your teeth, instead of being like 11 millimeters in the front, maybe they're 9. And then the distance between the top teeth and the bottom, instead of being 18 millimeters of the vertical dimension, is maybe 11. So they have worn out 1, 2, 3, 4, 5 millimeters out of the teeth.
Oh, that's
so
a lot.
That's a lot. So the maxilla, right, is fixed, but the mandible moves. But if the mandible, right, is supposed to stop at 18 millimeters like this, but now the mandible the teeth are worn out. So now the mandible is stopping at 10, 11 millimeters. The temporomandibular joint here is being hit. The end of the jaw is hitting the skull prematurely. So that is caused by the destruction of the teeth. So the anxiety is the culprit. And then it starts causing fractures, erosion, abfractions, vertical fracture sensitivity. Then when the teeth get so short that the mouth becomes smaller, the distance, right? It's like, oh, my mouth looks like a little old lady. Well, yeah, because you wore the teeth to nothing. So now what we have to do is a few things. The cheap way of fixing it, right, is giving them a mouth guard. So at least you open the vertical, and when they sleep,
they don't grind the teeth.
Well, no, they're gonna grind. They're not gonna stop.
Grind.
Oh, yeah, I need you for that. Yeah, we need to put needles for them to see if we can stop that. But it's a neurological now habit. They are doing that. They don't even know. No, I don't do it. How do you break your teeth? So I challenge my patients to speak to themselves and say, okay, subconscious mind, show me, wake me up when I'm doing it, and then they call me. And I say, call me. And they text me or call me. Yeah, I was in 95 and I was putting my teeth together and going like this. So they are like, then become aware. Now, how do I fix it in a permanent way? Would be for me to open the vertical dimension. The teeth are like this. Now I'm going to make them like that. So the distance of the maxilla to the mandible is going to be 18 millimeters. So that's going to open up the lower part of the face, right? Because now it was little old lady. Now we're going to make them like this. So that is, I pretty much do a reconstruction of the teeth. If they were, 11 millimeters and now they're 5, I'm going to make them 11. So by doing that, I increase the distance between the maxilla and the mandible, and then we find a release on the joint. Many people, when they are grinding so much, they find themselves getting dizzy. They have tinnitus, like ringing of the ear. Patients that have had surgeries of the ear, and it was all nothing to do with the ear.
Yeah.
It was actually the mandible compressing the skull.
Okay. So that's the structure problems.
It is, it's a destruction of structure. So the only thing that you can fix it is with fixing the structure.
Yes. So if a TMJ patient come here, and then I will tell them reduce the stress, reduce the anxiety level, and then I put needles around the temporomandibular joint to relax the muscle, and then they will grind the teeth less frequent, and then you can fix the structure.
Right.
So after the structure fixed, they will not grind the teeth that much.
Well, they have it's almost like a way for them to distress. So they're distressing. Some people smoke.
Okay.
Some people bite their nails.
Okay.
Some people pull their hair.
Okay.
Some people take Xanax.
Okay.
Right? And some people just break their teeth.
Okay.
Now, a lot of patients lately, they're on anti-anxiety medication.
Yes.
And I'm sending them to you because I know that one drug is going to cause 14 problems.
Yes.
So I need for them to be off the medication, but they don't know how to relax. They don't know what it is that I experienced there.
Yes.
Right? You put needles, I passed out. My nervous system feels like, I can take the world. Because for 45 minutes I passed out. So you inactivated my fight or flight. So we need you to help us disconnect in a way that then our immune system can be healthier and stronger.
Yes. Yeah.
Because once you start getting stronger, then you can get off the meds.
Yes, that's right. So reducing the stress and anxiety is the key to balance the immune system. And once you fix the structure, the joint, then they can keep that in a good condition. Yeah,
they have to continue to do things that are distressing. Walking, grounding, walking on the beach, swimming, being in contact in nature, gardening, biking, sports, walking. We have to really seek natural ways that are going to sustain that, because otherwise, if they don't do that, they're gonna fall asleep and break their teeth.
Yes. Thank you very much.
Yeah,
it's very informative.